Welcome to the pediatric presentation of rotavirus in infants. Throughout this video, we hope to answer the questions: what is rotavirus? What effects does rotavirus have on infants? And what can we do to prevent or treat rotavirus? Let's start by looking at the nasty little bug that is rotavirus. What is it? And why is it a problem? Rotavirus is the most common cause of severe gastroenteritis in infants and young children worldwide, with 28% of those cases resulting in death. In fact, rotavirus is responsible for approximately 500,000 deaths each year among children less than 5 years old. This virus causes severe diarrhea, vomiting, and fever, which can result in dehydration to children's already small bodies and immature immune systems. It affects the proximal small intestine, where it multiplies and destroys the epithelial surface, resulting in blunted villi, extensive damage, and shedding of considerable quantities of virus stool. Rotavirus is extremely contagious. Only a very few particles are needed to transmit the infection. It is spread through the oral fecal route or from person to person. This illness is most common during the winter, and the incubation period for the virus is 48 hours. Lastly, rotavirus will affect almost all children by the age of 5. Growth is defined by an increase in physical size and development and is a sequential process of gaining various skills and functions. The first year of life is noted for rapid growth and development. For example, infants doubled their birth weight by 6 months of age. During this time of accelerated growth, many organ systems become more mature. The immune system displays this concept. At birth, infants rely on maternal antibodies for protection. However, as they age, infants become able to produce their own immunoglobulins, such as IgA, by 6 weeks. Developmentally, at 6 weeks of age, infants still retain most of their Moro reflexes, which are reflexes all babies are born with that gradually fade with age. Psychosocial theorist Erikson ascribes the developmental state of trust versus mistrust to this age group. This means that the most significant task for infants to accomplish is to attain a sense of trust with their caregivers. This is essential in order to progress to higher levels of development. Cognitive theorist Jean Piaget labels infants in the sensory motor stage, meaning that infants interact with their environment using sensory motor perceptions and motor movement. Rotavirus negatively impacts infants' growth and development. Energy reserved for growing is displaced to fight off the disease process. This delays natural growth and development progression. The infant's immune system is not mature enough to provide a proper defense against the invading pathogen, and as such, the complications associated with rotavirus are more severe in this age group compared to older children. In addition, the infant endocrine system is functionally immature. Because of this, infants are prone to dehydration because compensation mechanisms are not fully effective. Rotavirus exacerbates this problem through diarrhea, causing further dehydration. Developmentally, rotavirus impacts the infant by straining the infant's relationship of trust with his or her caregiver. This is seen by the caregiver being unable to alleviate the infant's stress brought on by the disease. Now, let's examine a case study of rotavirus in an infant. DS is a 6-week-old Honduran female being seen in the emergency department after 3 days of persistent, foul-smelling, watery diarrhea and vomiting, accompanied by high fever and insoluble crying. The client's fontanelles are sunken and has no tears when crying. Her mother does not speak English, but it was noted through a hospital interpreter that no one in her family has received any vaccinations. The patient's current vital signs are heart rate 180, respirations 40, BP 75/55, temperature 104 degrees Fahrenheit, and an H&H, CBC, urinalysis, and rapid antigen stool test have been ordered. The first priority nursing diagnosis for this infant is deficient fluid volume, related to fluid volume loss as evidenced by diarrhea, vomiting, and fever for 3 days. The rotavirus infection causes frequent passing of watery stools and vomiting, making the child very dehydrated. DS presented with a fever of 104 degrees Fahrenheit, so this depletes the body's water in an attempt to naturally cool the body. Being an infant, the majority of her body weight is actually water. These combined issues result in significant weight loss, in addition to the sunken fontanelles may be observed upon assessment. Interventions for deficient fluid volume include encouraging the mother to continue breastfeeding. Breast milk will not only rehydrate, but it contains IgA for immunity and rotavirus G9P5 neutralizing capacity. For formula-fed babies, lactose-free formula may be better since the virus already irritates the GI tract, and this will prevent any further irritation. In addition, an oral rehydration solution, such as Pedialyte, is recommended in infants who are still able to intake oral fluids. If vomiting is severe, IV hydration fluids will be needed. Zinc supplements are also recommended to help in decreasing the severity and duration of the diarrhea, and probiotic supplementation replenishes intestinal flora. Our second nursing diagnosis is deficient knowledge related to unfamiliarity with information resources as evidenced by the mother not speaking English. From this nursing diagnosis, we can draw a conclusion that this situation puts DS at an advantage for not receiving ideal health care due to her parents' lack of health literacy. There are many ways to prevent the transmission of rotavirus, but we will focus on 3 interventions. The first way we can provide assistance to this family is to provide support and education by assessing the caregiver's knowledge, understanding the cultural differences, and giving information on potential complications. This first step is very important because assessing the patient's background will help to determine the level of care needed. Our second intervention is to educate the family about the practice of proper hand washing as an effective means of preventing spread of the virus. Because rotavirus spreads easily from person to person, ensuring adequate hand hygiene for each person that comes in contact with the patient is important. As nurses, we can demonstrate to her caregivers how to properly wash their hands and ask them to demonstrate it back. Surface decontamination with chlorine-based disinfectant, 10% hydrochloric acid, or quaternary ammonium compound combined with at least 40% alcohol are also proven to be effective. Finally, our third intervention is teaching the family about the rotavirus vaccination that can be administered to others who have not contracted the illness. According to the CDC, 3 doses of rotavirus vaccination should be administered at the ages of 2, 4, and 6 months. Currently, there are 2 types of vaccines. They are Rotatex and Rotarix, both which have been proven to be safe, efficient, and can prevent 85 to 98% of rotavirus infections. In this presentation, you learned about rotavirus in infants. As a reminder, rotavirus is the #1 cause of gastroenteritis, leading to diarrhea in the world. Infants are especially at risk for not only contracting the virus due to their immature immune systems, but also for severe dehydration that leads to fatality in 28% of cases. Prevention through vaccination is key. However, once contracted, nursing interventions center around rehydration, emotional support, and education to prevent further transmission. Due to the incredible risk that dehydration puts upon infants, we hope you have learned about the importance of preventing this illness, how to recognize its symptoms, and how to intervene as nurses. Now, we invite you to watch the following story of a family's experience with rotavirus. Thank you for watching this presentation.
As parents, you're supposed to protect your kids and provide everything you can.
A few months ago, our 2-year-old daughter had gotten what we thought was just a run-of-the-mill stomach virus and was vomiting and had diarrhea. And she seemed a little better in the morning, and then all of a sudden she just became rapidly worse. I mean, it was just constant vomiting, constant diarrhea. And so we went to the emergency room. And by the time we got there, she was severely dehydrated.
They were really having a hard time putting an IV in her, so they had to stick her like over 10 times.
She was crying and there were no tears, because she was so dehydrated. They tried in her forehead, both of her hands, her feet, her arms, her legs. She got to the point where when she would see someone coming at her with a needle, she would just take her little blanket and cover up her head.
It was one of the toughest things I've ever had to watch.
There was the vascular specialist team that they were talking about calling in to start an IV. They even had said that they may have to drill a hole into her bone marrow. And one of the nurses just said, let me give it a shot, and was able to get an IV started.
Rotavirus is so common that almost no one makes it to the age of 5 without having had this infection. But in the pediatric emergency rooms, we see so many children who end up hospitalized.
She started to get better. We could tell the difference right away, but they said that they were going to have to watch her for quite a while.
My husband was staying at the hospital with our daughter, and then they came in and said that her rotavirus test had come back positive.
Rotavirus is the #1 cause of diarrhea in infants and children.
Our doctor's office didn't have the rotavirus vaccine, and he'd said, just run over to the county health department. And I thought, rotavirus, no big deal. My other kids have had that.
You need to get your child vaccinated against rotavirus because it is a serious cause of diarrhea, the one that's most likely to have your child end up hospitalized.
It was horrible to watch her suffer like that, and then later to find out that I could have prevented it.
My wife and I were together taking care of her, and I thought, oh, this is great. So everything's going to be fine.
I'd called home to check on our youngest son, who'd also been sick, and our girlfriend that was babysitting said, I think you need to take him in to be looked at.
It's highly contagious. I often hear of families who have more than one child with this at the same time.
And they transferred him by ambulance to the same children's hospital. And he stayed for 3 days, and she stayed for 4 days.
But I still wasn't able to see him yet. I couldn't leave my daughter to go see my son.
The first night that he was in the hospital, we went through 22 diapers in like a 14-hour period.
You have trouble keeping up with it. And then just as the child is having diarrhea, they're also having vomiting.
And so it was like 5 minutes in the hall, trade places for a little while, wait till they were asleep, meet in the hall again, trade places.
Never crossed my mind that both my kids would be that sick at the same time.
There was laundry, probably 25 loads of laundry, all contaminated.
People try to prevent rotavirus through good hand washing, by cleaning surfaces, and those are important. But the best protection for children is through vaccination.
My actions caused my kids to suffer, and that's kind of a hard thing to swallow.